The question I have for this hour, and I would appreciate your help with this, because last night I was over at RT. We were doing the TV show, and one of the guys who works there was telling me how his mother, this is a guy in his 20s, his mother was in her 50s, and he said his mother was 4 months now without health insurance. And she has some serious health issues. But she was 4 months in without health insurance because under the Affordable Care Act, Obamacare, if you are 6 months without health insurance, then you qualify, and you have pre-existing conditions, then you qualify to get put into this government-funded high-risk pool, where basically you get kind of like Medicare privileges or something. I'm not sure exactly how the high-risk pool works. I don't know all the details of it, but you can get into it. And so and he said, she was on her insurance before, and she had lost her job. She was going to lose her insurance. She had COBRA for a while, and that was going to go away. And it was like, okay, this is my option. But there's this 6-month waiting period. So she went into the doctor and she said, give me, double dose of all my drugs, all the prescriptions that she's on, whatever it may be. Give me as much as you possibly can. And, just stock up on stuff because I'm going to have 6 months without seeing a doctor. Or I'll only see a doctor if it's an emergency because she's not a wealthy woman. I mean, she's a, single mom and it's life is tough here in the United States in those kind of circumstances and conditions, particularly because we don't have a social safety net. We don't have that freedom that we talked about yesterday. Franklin Roosevelt saying that you're not free if you are necessitous. You are not free if you're sick and don't have access to a doctor. You're not free if you're out of work and want a job and don't have access to one. You're not free. The list goes on. So, but in particular, you're not free if you're sick and you don't have a way of dealing with it. Or if you're sick and you have to make a choice between being homeless or paying the rent versus paying the health care bill. So tomorrow, the Supreme Court is going to issue their dictum. And I've had people call into this program, and I say over and over again, the Supreme Court is our royal family. They are the kings of America. Just like the Queen of England can strike down laws passed in England, or at the very least dissolve Parliament. I'm not sure of all the full extent of her constitutional, or actually there's no constitution in England, but her common law powers. But she can dissolve Parliament. She can say, okay, that's it. You guys are out of here. Fire the Prime Minister. Everybody starts all over again. And, we've got our royal family. It's these 9 guys sitting in black robes, men and women sitting in black robes, just 2 blocks from where I'm sitting right now broadcasting to you. And they can say, we don't like that law. We're going to get rid of it. Or, hey, we've got an idea. How about what if corporations were people? Now, no Congress ever said that. Ever. Ever. In fact, hundreds of members of Congress over the last 100 years have loudly said what a mistake it would be. Or the Supreme Court could say, hey, what about money isn't actually property? I know we all, thought it was property for a long, long time, but no, it's not really property, it's speech. Again, no Congress has ever proposed that. No president has ever proposed that. In fact, all the way back to Grover Cleveland, who was president during the 1886 Santa Clara decision, they have decried it. Read Grover Cleveland's 1887 State of the Union address. Blow your mind. He talks about how corporations, trusts, and monopolies are the iron heel on the neck of the people. In his State of the Union address. So anyhow, the SCROTUS here is going to knock down the Affordable Care Act, or maybe not, Obamacare. And my guess, if I had to play bets, if I had to put odds down, and there's, by the way, people doing that over at intrade.com. This is the Irish betting site where any place in the world where it's legal to bet, I guess. I don't know what the laws are here, but in any case, people are betting on whether the Supreme Court's going to knock it down. And it was polling 78% last night. It was 75% this morning when I looked at it. So it's been above 70% consistently for months. whether the individual mandate will get knocked down. And my guess is that a bunch of the good things that are in Obamacare, kids can stay on their parents' plan until they're 26, children can't be discriminated against based on pre-existing conditions, that might get knocked down. But you can flip a coin on it. Or starting in 2 years, nobody can be discriminated against based on pre-existing conditions. That might get knocked down. But, that's debatable. But I think for sure the mandate is going to get knocked down. And, but we'll see. So anyhow, the question that I have for you is, what parts of Obamacare do you like and what parts do you dislike? Do you have any personal stories about Obamacare, like I was sharing with you from my coworker whose mom is just trying to get into this high-risk pool? Here's some of the things that are in the features of the Affordable Care Act year by year. This, by the way, is from healthcare.gov. So this is sort of the official, definition of this. In 2010, it was 2 years ago, a Patient's Bill of Right went into effect, and cost-free preventative services began for many Americans at no cost. You could show up in these community health clinics. Bernie Sanders actually put this into the law. 10,000 community health clinics around the country that do dental work as well as healthcare work for low-income people, and people can get mammograms and just a whole variety of tests. Find out if there's anything wrong with you. 2011, people with Medicare can get key preventative services for free, and they also get a 50% discount in brand name drugs, which starts closing the donut hole. 2012, there were a whole bunch. Well, actually, let me just go through these in even more detail. In 2010, the consumer protections, putting information for consumers online, prohibiting denying coverage of children based on pre-existing conditions, preventing rescission, prohibiting insurance companies from rescinding coverage. If you have coverage, it used to be that if you made an error in your application or you forgot that you had acne when you were 16 and you'd taken some drug for it, which might cause side effects like cancer 30 years later, and you get that cancer, they would say, hey, you have a pre-existing condition. You can't do that anymore. That took effect in 2010, September 23rd, 2010. They eliminated lifetime limits on insurance coverage. They regulate the annual limits on insurance coverage. You can appeal now decisions of your health insurance company. Used to be if you called them enough, if you called them and said, hey, I don't, what, you just kicked me off? You can't, they just hang up on you. And if you kept calling back and calling back, they would have you arrested for harassing them. Or if you got on a plane and flew to wherever, the health insurance company is and stood outside their offices with a sign, they'd have you arrested. This is another reason why I think we should have Medicare for all, because we can all picket our members of Congress. Try picketing your health insurance company. You will find out very quickly about private property law. Anyhow, I'm going to continue. I'll finish going through this list, and then I'm going to pick up your calls about your experiences with the Affordable Care Act. And
this is the Thom Hartmann Program.
And what you might miss the most, or what you'd like to see done away with. Right after this, 16 minutes past the hour.